Panic attack. A panic attack is a sudden episode of intense fear that triggers severe physical reactions when there is no real danger or apparent cause. Panic attacks can be very frightening. When panic attacks occur, you might think you're losing control, having a heart attack or even dying. Many people have just one or two panic attacks in their lifetimes, and the problem goes away, perhaps when a stressful situation ends. But if you've had recurrent, unexpected panic attacks and spent long periods in constant fear of another attack, you may have a condition called panic disorder. Although panic attacks themselves aren't life-threatening, they can be frightening and significantly affect your quality of life. But treatment can be very effective. Panic attacks typically include some of these signs or symptoms. 1. Sense of impending doom or danger. 2. Fear of loss of control or death. 3. Rapid, pounding heart rate. 4. Sweating. 5. Trembling or shaking. 6. Shortness of breath or tightness in your throat. 7. Chills. 8. Hot flashes. 9. Nausea. 10. Abdominal cramping. 11. Chest pain. 12. Headache. 13. Dizziness, lightheadedness or faintness. 14. Numbness or tingling sensation. 15. Feeling of unreality or detachment. One of the worst things about panic attacks is the intense fear that you'll have another one. You may fear having panic attacks so much that you avoid certain situations where they may occur. How long can a panic attack last? Panic attacks usually last 5 to 20 minutes. But some people have reported attacks lasting up to an hour. What causes panic attacks? Experts don't know exactly why some people experience panic attacks or develop panic disorder. Your brain and nervous system play key roles in how you perceive and handle fear and anxiety. Researchers think that dysfunction of your amygdala, the part of your brain that processes fear and other emotions, may be at the root of these conditions. They also think chemical imbalances in gamma-aminobutyric acid, GABA, cortisol and serotonin may play a large role. Your risk of having panic disorder increases if you have 1. A family history. Anxiety disorders, including panic disorder, often run in families. 1. You have a 40% increased risk of developing panic disorder if one of your first-degree relatives, biological siblings, children or parents, has the condition. 2. Mental health conditions. People who have anxiety disorders, depression or other mental health conditions are more prone to panic attacks. 3. Adverse childhood experiences, ACEs. ACEs are negative experiences that happen between the ages of 1 and 17. 3. These experiences are usually traumatic events. 3. ACEs can contribute to the development of panic attacks and panic disorder. What triggers panic attacks? There's often no specific trigger for panic attacks. But people who have a phobia can experience phobia-related triggers that lead to a panic attack. For example, someone with trypanophobia, intense fear of needles, may experience a panic attack if they have to get their blood drawn for a medical test. For some people, the fear of having a panic attack is often enough to trigger one. It's important to note that one of the criteria for panic disorder is that the panic attacks don't have a known trigger. How are panic attacks diagnosed? Your healthcare provider will ask about your symptoms and medical history. They may run tests to rule out medical conditions that cause similar symptoms as panic attacks, such as heart disease, thyroid disease and respiratory, breathing, problems. If there's no underlying physical cause, your provider may make a diagnosis according to your symptoms and risk factors. How are panic attacks and panic disorder treated? Psychotherapy, medications or a combination of both are very effective in treating panic attacks and panic disorder. How long you'll need treatment depends on the severity of the condition and how well you respond to treatment. Psychotherapy. Psychotherapy, talk therapy, is a term for a variety of treatment techniques that aim to help a person identify and change unhealthy emotions, thoughts and behaviors. Specific types of psychotherapy that can help with panic attacks and panic disorder include 1. Cognitive behavioral therapy, CBT. In this type of therapy, you discuss your thoughts and emotions with a mental health professional, such as a licensed counselor or psychologist. 1. This specialist helps identify panic attack triggers so you can change your thinking, behaviors and reactions. 1. As you start to respond differently to triggers, the attacks may decrease and ultimately stop. 2. Exposure therapy. This involves exposing you gradually and repeatedly, in your imagination and/or in reality, to whatever triggers a panic attack. 2. Over time, you learn to become comfortable with the situation instead of it causing anxiety and panic. 2. You'll learn relaxation techniques, such as breathing exercises, to manage your anxiety throughout the process. Medications. Medications that can help treat panic attacks and panic disorder include 1. Antidepressants. Certain antidepressant medications can make panic attacks less frequent or less severe. 1. Healthcare providers may prescribe serotonin selective reuptake inhibitors, SSRIs, or serotonin norepinephrine reuptake inhibitors, SNRIs. 1. SSRIs include fluoxetine, Prozac, and paroxetine, Paxil. 1. SNRIs include duloxetine, Cymbalta, and venlafaxine, Effexor. 2. Anti-anxiety medications. Providers most commonly prescribe benzodiazepines to treat and prevent panic attacks. 2. They help with anxiety but have addiction potential, so it's important to take them with caution. 2. These medications include alprazolam, Xanax, and lorazepam, Ativan. Prevention. How can I prevent panic attacks? Your healthcare provider can help you identify triggers that bring on panic attacks. During psychotherapy, you learn strategies to manage triggering events and prevent an attack. You can also take these actions to lower your risk of having a panic attack. 1. Avoid caffeine, alcohol and smoking. 1. These can make panic attacks worse. 2. Exercise regularly to help you manage stress, relieve tension and boost your mood. 3. Eat a healthy diet. 4. Manage stress in healthy ways. 5. Talk to your provider before taking herbal supplements or over-the-counter, OTC, medications. 5. Certain substances can increase anxiety,